Acute lymphoblastic leukemia, known as ALL, is a malignant disorder of lymphoid progenitor cells that affects both children and adults. The peak prevalence is between the ages of 2 and 5 years old. At diagnosis, 15% of the people diagnosed with ALL are 10 through 20 years old. Children tend to benefit more from treatment than adults. ALL is a type of cancer where the bone marrow makes too many immature lymphocytes. Lymphocytes are a type of white blood cell. ALL may affect red blood cells, white blood cells, and platelets. A person with ALL may express symptoms such as fever, excess bruising or bleeding, petechiae, which are red spots under the skin caused by bleeding, bone or joint pain, lumps in certain places on the body, paining below the ribs, weakness, fatigue, paleness, or loss of appetite. A doctor could diagnose a patient with the disease if the following occur: lumps or anything unusual present on the surface of the body, and if the red blood counts, white blood counts, or hemoglobin amounts are far from normal. In a child with ALL, a majority of the stem cells become lymphoblasts, or lymphocytes, and are not able to fight infection well. These are the cancerous cells which increase their totals in the blood and bone marrow. While not knowing the exact causes of ALL, scientists believe that some conditions make patients more vulnerable to develop leukemia. Conditions such as Down syndrome and neurofibromatosis can make the child or adult more at risk for developing ALL. Ionizing radiation has been a factor in a few cases where there was an increased risk of ALL in a baby that was x-rayed while still in the womb. Probability of radiation affecting the health of a child are very slim because pregnant women are not x-rayed often and radiation levels have been lowered tremendously throughout the years. Race and economic status seem the least likely to affect a patient's chance of developing ALL, but there has been evidence to say this may be a factor. For example, Hispanic children in the United States are more likely than Caucasian children to develop ALL. Also, for unknown reasons, children living in wealthier countries are more likely to develop ALL than children from poor countries. In 2015, there was an estimated 84,770 people with ALL in the United States, compared to 480 Canadians in 2013. There are many gene factors that can contribute to ALL, but the gene MLL is associated with a poor prognosis in infants with ALL when the gene rearranges. The ability to detect an MLL gene arrangement should make it possible to identify patients who have poor prognosis, resulting in aggressive chemotherapy or bone marrow transplantation needed for treatment. TLE1 is a transcriptional corpressor that regulates gene expression, and its dysregulation has been observed in many cancer types. Lower levels of TLE1 expression are associated with bad prognosis features in ALL. There are many different types of treatments for ALL, but one is chemotherapy. Chemotherapy is a cancer treatment that uses drugs to stop the growth of cancer cells and is taken by mouth or injected into a vein or muscle. The drugs enter the bloodstream and reach the cancer cells throughout the body. This is known as a systematic chemotherapy. Chemotherapy can be placed directly into an organ or body cavity where the cancer is to target the cancer cells in those areas, and this is known as regional chemotherapy. Combination chemotherapy uses more than one anti-cancer drug. Intrathecal chemotherapy may be used to treat childhood ALL that has spread to the brain or spinal cord. Radiation therapy is a cancer treatment that uses high-energy X-rays to kill the cancerous cells and keep them from growing. External radiation therapy and internal radiation therapy are the two types of treatments. External radiation uses a machine outside of the body to send radiation to the cancer. Internal radiation uses a radioactive substance that is sealed in needles or vials that can be placed directly into or close to the cancer. Radiation can also be used to prepare the bone marrow for a stem cell treatment. Stem cell transplant is a method of treatment where high doses of chemotherapy are given and then blood-forming cells destroyed by the cancer treatment are replaced. The stem cells are removed by a donor from the blood or bone marrow and are given to the patient through infusion. Tyrosine kinase inhibitors are a drug used to attack specific cancer cells and are targeted therapy drugs used to block the enzyme which causes stem cells to become more white blood cells or blasts than the body needs. Targeted therapy uses drugs and other substances to identify and attack specific cancer cells without harming normal cells in the process. Age can affect the treatment regimen the patient undergoes. For example, children 10 years and older and adolescents with ALL are given more anti-cancer drugs and higher doses of anti-cancer drugs than younger children. There are 3 different phases of treatment for ALL. The first one's remission induction, the second's consolidation, and the third's maintenance. Each of these are the same as each other, they just differ in the amounts of treatment and the aggressiveness taken. To diagnose leukemia, doctors can perform a blood test to show possible leukemia cells. Before confirming the exact diagnosis, the doctors need to examine a sample of bone marrow from the patient. ALL is cancer of the blood, so it does not have the stages the way solid tumors normally do. The indicators of ALL include the white blood cell count, high levels of leukemia cells in the spinal fluid, and certain mutations in the cells. Leukemia can occasionally be present in the spinal fluid, which is known as central nervous system. Doctors can perform a spinal tap to obtain fluid to examine whether disease has spread to the spinal fluid. The purpose of one clinical trial was to examine the impact of clinical and biological characteristics on the outcome of the treatment of ALL. The patients in remission received multi-agent consolidation treatment and central nervous system prophylaxis, late intensification, and maintenance chemotherapy for a total of 24 months. The intensive chemotherapy regimen produced a high remission rate and a high proportion of durable remissions in adults with ALL. Children with Philadelphia chromosome positive ALL have a poor prognosis, and the optimal treatment for this variant of ALL has no consensus. Out of the 326 children and young adults, 267 patients had complete remission after induction to chemotherapy. The results of this trial concluded that the positive Philadelphia chromosome is associated with poor prognosis. The Eastern Cooperative Oncology Group used karyotypes as an independent prognostic factor in adult ALL. The results of the trial concluded that the karyotype complexity increased the risk of treatment failure. That demonstrates that the Philadelphia chromosome should be used to risk stratify adults with ALL as well. The implications of the detection of residual disease after treatment of ALL are unclear.